Hello everyone. Today we are going to briefly talk on our channel about an important diagnosis called PANDAS. But before that, I want to mention to you about our channel. It's Comprehensive Psychiatry, and I'm Dr. Imran Akram. And please do subscribe to the channel and hit the bell for the notification. So let's proceed. PANDAS, which is PANDAS, like too many pandas running around. So it's a similar acronym. But what does it stand for? It stands for Pediatric Autoimmune Neuropsychiatric Disorders. This is caused by repetitive strep infection, which is streptococcal infection, a bacterial infection. Normally presents as sore throat, sinusitis, cellulitis, different ways of presentation, cough, and different things. And what happens is usually it can happen in kids, but also in teenagers. Normally people will have an infection, they will go to the doctor, they get treated, and they're fine. But sometimes you notice after these infections, there's an acute change in behavior. But what you notice is that people might get treated for the infection and yet they can still develop these symptoms. Sometimes we see that after repetitive exposure to this bacteria, that the kids, you will notice, they may have vocal tics, and these tics can present themselves during eating, during studying. You might notice them clearing their throats or making certain sounds. They also can have some obsessive compulsive disorders and checking behavior. They can become very, very agitated easily. So you can see mood changes, behavior changes, a lot of anxiety can come into play. And occasionally sleep disorders can come in the picture as well. Rarely bedwetting. I haven't really seen it myself, but it is listed as one of the presentations in the data. Now, I'm just briefly describing this because it can go unnoticed very easily, and you won't know what is happening. The treatment, as we treat these infections with the antibiotics and stuff, are very important. But sometimes what is important for parents to notice is the onset of these symptoms that include the infection, and right after the infection, these behavioral disturbances. So the laboratory tests, they can include tests for the strep infection, or you can culture, or you can do the antibody test. But the treatment can include the antibiotics. Antibiotics can help treating the infection and will prevent hopefully, recurrent exposure, which of course is one of the risk factors for this PANDAS infection or presentation. But then the behavioral problem sometimes may not respond to the antibiotics. So you may have to use antidepressants like the SSRIs, which is the serotonin receptor medications. You will have to go to a psychiatrist, a child psychiatrist, or a child neurologist. And then on top of that, you can also, there are some other treatment options like intravenous immunoglobulin, steroids, and some other plasmapheresis, which is not done generally in normal clinics, in ordinary, like I meant, outpatient clinics, but specialized centers do. When you do check the antibodies, they respond to the treatment. Like the subsequent testing will show that once you've been treated by antibiotics and the infection is treated, the infection goes away, and you will see the improvement in the lab test. Sometimes we see that these symptoms take a long time to wane, to get better. The other important thing is these symptoms can resurface upon subsequent exposure to this bacteria. And so if you have a recurrent streptococcal infection, you can start having these symptoms again. So it's very important to talk to your pediatrician, child psychiatrist, child neurologist about these things, because like I said, a child neurologist who I discussed with was astonished to hear that this disorder is still present, and it manifests this way, because she had read it but never seen it. So similarly for psychiatrists, we sometimes will never see it throughout our career. Thank you very much. That's all. I hope that was helpful. Just a brief description of PANDAS. Easy to remember, just like the cute pandas running around. It's many of them, but this infection can be discreet and can go overlooked quite easily. Thank you very much. I hope it was beneficial. My goal with this short presentation is just to share some knowledge, and that's all. And if I can get the word across to some people, and it can benefit them, then I've done my job. So thank you again. All the best. Until next time. Thank you very much.